Hello, I'm Dr. Sanjay Prakash, consultant urologist and microsurgical andrologist. Today, we are going to discuss about a common but often ignored topic about men's health, that is benign prostatic enlargement as well as erectile dysfunction. Why this is important is both benign prostatic enlargement as well as erectile dysfunction are interconnected. Benign prostatic enlargement affects about 50% of men more than 50 years and almost 90% of men more than 80 years. Erectile dysfunction affects about 1 in 4 men less than 40 years, and after 40 years it starts increasing in prevalence. Both of them affect the quality of life, the mental health as well as relationship intimacies. Now let us try to understand what exactly this benign prostatic hyperplasia and erectile dysfunction are. Benign prostatic hyperplasia is non-cancerous enlargement of the prostate which obstructs the flow of urine and subsequently gives rise to the urine symptoms. Erectile dysfunction is defined as inability to achieve and maintain good quality erection to have penetrative sex. The prostatic enlargement issues are common in men more than 50 years because of the hormonal changes as well as a reduced sexual frequency. Erectile dysfunction, previously it was considered as a disorder of the elderly male, that is men more than 50 years only. However, the recent study shows that it starts occurring much earlier, that is in less than 40 years itself, and starts to manifest increasingly after 40 years. Now looking at the symptoms, benign prostatic hyperplasia and the symptoms can be classified into two categories. One is the voiding symptoms and the storage symptoms. The voiding symptoms includes hesitancy, straining to pass urine, poor stream while passing, and the sense of incomplete voiding, that is your bladder always feels that some amount of urine is inside. The storage symptoms include frequency, more the nocturnal, that is the increased urination at the night time, urgency and urge incontinence. How erectile dysfunction presents it will gradually start increasing. Initially there will be difficulty to maintain erection, then there will be difficulty to achieve erections, the quality of morning erections will start dropping. Now let's see who are at risk of developing these conditions. Both benign prostatic hyperplasia and erectile dysfunction share the common risk group except for the age. BPH is commonly found in men more than 50 years with family history of prostatic enlargement, patients who are diabetes, hypertension, dyslipidemia, smoking, alcohol consumption and sedentary lifestyle. Erectile dysfunction can be purely psychogenic or organic causes or mixture of both. Why organic is because of the increase in incidence of diabetes, hypertension, dyslipidemia, the alcohol and the drug culture, smoking in the younger age group results in manifesting of erectile dysfunction in the earlier age group. Now let's look at certain techniques how we can prevent them. It starts with a very good lifestyle. First is a diet. I would always recommend a good quality diet which is a Mediterranean type of diet. Mediterranean type of diet includes simple carbohydrates, whole grains, simple proteins in the form of seafood and poultry, whole nuts, seeds like the pumpkin seeds, more of fresh fruits and vegetables in the diet. Second is adequate rest. Our human body requires at least 6 to 8 hours of sleep in the right time. Next, regular exercise. Moderate aerobic activities at least 30 minutes a day. You can go to the gym. Not only that, regular fast-paced walking, jogging, swimming, games like badminton, cricket, that would be sufficient. Next is stress management. Go for regular yoga, meditation or even counseling. It is very important to quit smoking, reduce or avoid the consumption of alcohol and avoid any recreational drugs, and strict diabetic, hypertension and dyslipidemia control. When do you think is ideal to meet a doctor for the symptoms? We always recommend that whenever you feel anything abnormal about your urine pattern or anything abnormal with your erection, that's the right time to meet a doctor, because once you come in the starting stage, the symptoms will be easy for us to treat as well. How we evaluate prostatic symptoms is with simple basic tests. We do a PSA, which is an indicator of the prostate health, a basic ultrasound of the abdomen which shows us the size of the prostate, a uroflowmetry which is your actual urine pattern, a basic creatinine to assess the renal function and a urine routine. We diagnose prostate issues with simple diagnostic tests. We do a PSA which is an indicator of the prostate health, a ultrasound of the abdomen to assess the status of the kidneys, the prostate size, a urine routine, a uroflowmetry, which gives us a graphical representation of your actual urine pattern, and a normal creatinine to assess the kidney function. With respect to erection, we check your recent diabetic and cholesterol levels, we check your testosterone axis, and we do a vascular scan to assess the stiffness of your blood vessels. The treatment modalities for these conditions ranges from simple lifestyle hacks to surgeries. With respect to prostatic enlargement, obviously the first is going to be a lifestyle modification followed by regular medication. There are simple medications or a combination of these medications, and we treat them according to the prostate size and your symptoms. If it's less than 30 cc and the significant symptoms, we would always start with medications. If it's more than 30 cc, we would also start medications, and depending upon the symptoms, we would consider surgery as well. Looking at the surgery options, it's not the older times where we always have to cut across your abdomen. No, we have simple endoscopic techniques by using regular current or laser known as the TURP or the HOLEP. By these techniques, we will be able to treat the prostate. But whereas if it's going to be larger size prostates, more than 100 cc, there are laparoscopic and robotic excision of the prostates. With respect to erectile dysfunction, yes, it again starts with lifestyle modification, medications, penile pumps, intracavernous injection. This is the era of regenerative therapy. There is shockwave therapy, the penile growth factor injection, and if everything fails, there is the penile processes surgery. The hospitalization required for the prostate procedures are low, ranges from just 1 to 2 days. If it's going to be a laparoscopic or a robotic procedure, maximum 2 to 3 days. Now let us see about certain common myths associated with the prostate enlargement. Firstly, can BPH be cancerous? No, this is a non-cancerous enlargement of the prostate. Second, does only men more than 50 years develop these symptoms? No, even men in the 30s and 40s can develop these symptoms. They can have a tight bladder neck or a prostatitis, which is an inflammation of the prostate, which can also give rise to similar symptoms. Next, is only a large size prostate associated with such symptoms? Not necessarily. Even a small 10 to 15 cc prostate can also give rise to these symptoms. Lastly, by reducing the water intake, does your urine symptoms reduce? Absolutely not. On the contrary, reducing the water intake can lead to complications like urinary tract infections. Many patients ask us, sir, what if we don't treat the prostate symptoms and just let it go like that? What will happen to us? Yes, it can give rise to a lot of harmful effects. As complications of prostatic enlargement, you can have hematuria, that is blood in urine, recurrent urinary tract infections, the increased incidence of stone formation. Progressively, your urine will start dropping, and at a point, you will develop urinary retention, that is complete blockage of the urine, and as a terminal, your kidneys can also take a hit and your kidneys will fail, necessitating a dialysis or renal replacement therapy. To conclude, both BPH and erectile dysfunction are easily treatable. There are multiple treatment options, and the options can be customized according to a patient's requirements. So, it is always better to present to the doctor at the early symptoms. There is no need to be shameful about it. Please lose the stigma around it. There is nothing to be shameful about it. Always consult your qualified urologist for any of these symptoms. Please spread the message to your fathers, to your grandfathers, and your healthy men in your life. Thank you very much.